Good morning, good evening, and good afternoon to everyone. This paper is aiming at discussing what should we do to mitigate the impact of climate change on our Mother Earth. We all know that currently there is changing pressure, temperature across the globe. Many reasons led to that, including the greenhouse gases, solar radiation, and the changes in the land surface properties. But more importantly, the impact of that led to changes in our lives, led to changes in the bionetworks that we are living in, led to changes in the socio-economic determinants and changes in the different countries and states, moving people from wellness to poverty. And also it led to changes in our behavior. How should we adapt to that? Specifically on health, the climate change has a direct and indirect impact on our lives. Directly, like what we see during the hot weathers in terms of heat strokes, the changes in the temperature leading to cardio-respiratory diseases like asthma and so on. Also, it can lead to direct death from natural disasters or from floods or famines, the excess of water or the absence of water. And also it led to a change in the distribution of diseases across the globe, the water and vector-borne diseases. The map is now changing and things are not what we have seen 10 years or 20 years before. Also, it has a direct socio-economic and psychosocial impact on everyone on Earth. The indirect impact of the climate change is socioeconomically, it affects the access and affordability of health services. And also it leads to behavioral shifts in adaptation and negatively may affect the health outcomes. So my study is basically trying to determine the key investments that we need to implement to mitigate that kind of negative impact of climate change on health. The methods I used, literature review, reviewing the written literature around health, climate, and changing environment, and the critical appraisal of those approaches and trying to come out with suggested solutions. So the outcome of this paper or research is the climate change impact on health is inevitable. It will continue as long as the temperature is rising, and it can lead to exaggerated risks, and especially among vulnerable and those who already before we started seeing the climate change results were already in a disadvantaged health status. So based on the literature that I reviewed, there is two types of risks associated with climate change. Some of them are specific to the health system, including all different building blocks or layers of the health system, and some risks related to or gaps related to the health sector in general. So in terms of health system risks, wherever we have high impact of climate change, there is weak governance and rigid structures. There is low political commitment and low or rigid financing mechanism. The human resource for health strategies are not responsive and not flexible enough to adapt to the rising needs. poorly performing systems in terms of health information or supply chain to quickly respond to the arising needs from the climate change, and of course, the low quality and high cost of health services. In those areas where we have the high impact of climate change, like in developing countries, the sector response normally lacks the decision-making power and prioritization of health, and there is clear gaps in coordination within government and between government and non-government actors. And there is an issue with sharing information and sharing it timely to be useful to respond to the climate change risks and needs. So based on that, the required reforms are basically classified around those two different streams. The sector-wide, there is a need to improve the intersectoral decision-making between, for example, health, water, and environment. There is a need to strengthen the coordination and the decision-making between those sectors, including government and non-government actors. There is a need to establish a kind of information hub where information from water, from health, from veterinary, from different sectors that affects the health situation. There is a need to gather those information and triangulate it and make sure that it leads to the right decision and the right prioritization. In terms of health system, the reform that is required within the health system is to make sure that we consider the nexus, the humanitarian development and peace nexus. There is a need to invest durable solutions, long-lasting investments that can respond to humanitarian needs and also at the same time develop the health system in the long term. And also we need to focus on the health system investments need to be focused and flexible to respond to the population needed, especially the disadvantaged population. I do thank you, and I hope this paper lead to improvement in how we respond to the climate change in the world. Thank you.